and LLC. However, she is a former city councilwoman from Wilmington, and she's also one of my dance partners. I'll never let Marie go get by without me announcing that she's a fabulous dancer, doing great work in the Hispanic community. She ran for mayor. Wilmington would have made her the first Hispanic female mayor of Wilmington, but we fell a little short that time. I know we're going to get in again, but she's here to share with you guys what she's doing right now. Please give a warm welcome to Ms. Maria Cabrera. And I'm going to bring you back to the podium. I tell you what, she can dance too, man. Y'all can YouTube our video, I'm gonna tell you. We did it in, we were advocating for the March of Dimes, giving back to the community, the young folks, anyway, Maria Cabrera.
Okay, excellent. Well, I just want to say thank you for the opportunity, the privilege, the honor to be here to speak with you today. Somos muy pocos, pero somos muy locos. That means we might be a few, but we're very crazy, which means we're going to get it done. So thank you. I do want to recognize, yes, my friend Linwood and I, nothing like a good salsa, bachata, and merengue to bond you for life. And when he asked me to come and speak, I said, well, what should I speak on? And what was really burning inside of me was to talk about the power of one and the difference we can make, one person at a time. We shouldn't ever think that one person cannot make a difference, because with one you multiply and you have more. So I said, let's talk about the power of one and unity, because I still don't see the unity between the Latino community and the African community, the African American community, that we should be working together on many of the issues, because they're affecting all of our communities. So we're going to speak about that today. We're going to preach a little bit about that. But first, yes, my role as a certified federal navigator, which actually falls right in line with the topics that we're speaking about today, because lack of equitable access to health care has been prevalent in our nation, and it especially affects the people that are in the lower income bracket to middle income bracket that cannot afford to purchase insurance. And back in the day, we didn't have the Medicaid expansion, so a lot of the low income people were being lost as well. And the fact that we hear what's going on at a national level, that they're trying to take away our health care, and people have come together one by one. They have made a difference, and those marches and those town hall meetings, they are relevant, because the power of numbers, the power of unity on any cause can make a difference. And we've seen that historically, but we got to keep doing it. We can't let up, and I feel that somehow we've let up in the 50 years since the Civil Rights Act, and although we've come a long way, I look around and we haven't come that far. Just because you don't sit at the back of the bus doesn't mean that we really have made huge gains. We should be further ahead for a country that we say we are the greatest country. And that isn't happening. And one of those issues is health care. And I'm an advocate, and believe me that even when they laid us off for a week, 10 days, where we did not get paid, I still went out there, I worked, I was at the Hispanic Festival, because that was the week that they had not released the funding for the navigators. We were fortunate in Delaware because we're a super navigator entity. Of course, they have the super senior navigator, that's why. But we are a super navigator entity, and we were able to keep our funding and to be here along with Westside Health. They're also a navigator entity, but there were so many navigator entities that were shut down across the nation, and that was by design, to keep people from signing up, because at the end of the day, if you're not an HR professional, this whole issue of insurance is very confusing. So imagine for people who have never had insurance before. Not only do we help them enroll, we also teach them how to use their coverage. You'd be surprised how many people have come back to me year after year to sign up, and they haven't even gone to the doctor. And I said, what? They're not even using their insurance. They're only paying it so they don't pay the penalty. That's not the reason you should do this, so that you don't pay the penalty. You have to use that insurance for all the obvious reasons. Our communities are suffering from certain diseases that are prevalent in our community. Why? Because of the lack of access to prevention and wellness. So prevention and wellness is important. When I look at the Latino community, diabetes is prevalent among the Hispanics. Women that have the highest mortality rate, breast cancer, they have the lowest incident, but they have the highest mortality. Why? Because of the education. You have to educate people about getting the screenings. And with the African American community, we know that high blood pressure, hypertension, heart disease, and diabetes is also in there, but the Latinos got you beat on that one, and primarily the Mexican community. So we have to educate people about prevention and wellness, and that would really bring the cost of a lot of things, healthcare in America, by being able to have insurance, accessible insurance, equitable insurance. Now the rates keep going up because of all the rhetoric. It kind of backfired on them because the law says that you shouldn't pay more than 9.66% of your annual salary for health insurance. So if anybody here is paying for employer insurance or any insurance, COBRA, that exceeds 9.66%, you qualify and you're allowed to go into the marketplace. So please see me. With Medicaid in Delaware, we had a Medicaid expansion. So that means that people, you can be making up to $16,642 and you would qualify for Medicaid. And a lot of folks don't know that. And through the years, historically, Medicaid was given to just the women, not the men. And there's people who are still in that mindset. So it's important that we let them know that men can sign up and qualify for health insurance for Medicaid as well if they're not working or making low wages. So we know that the Affordable Act protects your right to have access to health insurance, to get all your screenings, any preventative work is covered at 100%. You're going to get a tax subsidy, and it's all based on your income. Your application has to look like your income tax application will look like in 2019. So we're looking at 2018 income. So this is an advanced premium tax credit, which means it's paid in advance to the insurance company on your behalf, and then you pay the difference. And I'm telling you, I have people that are getting $2,000 in tax subsidies, paying $214 for health insurance at the age of 61 and 63 because they're still not in the Medicare bracket. So you can qualify, and what I need you to do, and this is going to be the first call to action, because today I'm going to talk about the power of one, unity, and the call to action, what we need to do. Because it's great to have conferences, it's great to do the marches and all of these things, but what happens after that? It's about the action plan, it's about implementing, because we can sit here and talk and cry on each other's shoulders about how bad things are. We can have a depression session, and I hate to admit that I've even felt depressed, but I have. And I'm sad, and I'm angry, and I'm enraged, and I don't feel like really socializing with people anymore like I used to. Everything turns into an argument. Nobody talk about politics at the Thanksgiving table. Please keep the families together. That's all we have left. But you know what? I'm going to use that rage, and I'm using that rage to take action, to say no, no mas. I can't sit here still and allow what is happening in our nation to happen. And you know why it happened? Because too many people sat home on that day. That's why it happened. So I hope a lesson has been learned. So now let's talk about the power of one. I'm proud to say that I attended the Women's March in Washington, D.C. I was there, and it was, I get chills just thinking about it. It was so amazing. They expected 250,000 of us, and 750,000 showed up. So many women united. Not one incident, nothing negative happened that day, because when we come together, we unite. There were black women, white women, Asian women, there were Muslim women, Christian women, Hindu women. They were all there. We didn't care about how each other looked. They were young. There were little girls. There were older women walking with their canes and their walkers or in their wheelchairs because they were not going to miss this. There was people who had never been to Washington, D.C. before, and they said, we came because we felt that it was important. That day, I was feeling so down, and I laid in my bed. I said, I don't know, I really don't have to go. And then I'm looking at my women's app, the Women's March app, and I'm saying, but these women are traveling from California and Ohio and Montana and Texas. How can I live 2 hours away from D.C. and not show up? Oh no, girlfriend got it together, went down there, picked up my friend, and off we went to the march. And we jumped in at some point because it was all over. It was amazing, but let me tell you about the march. We didn't just march, there was a call to action. So we had this wonderful Women's March app. So here goes the next call to action for the NAACP. I was looking through the app store today. I did not see an app other than when you have your conferences for people to know where to go, how to use Uber, what to do, and your breakout sessions. So on a national level, and if we have to do it on a local level, we have all these young people learning how to write codes and create apps. Let's have an NAACP app where we can communicate with each other, so we can reach the young people as well. And those that are not so technologically savvy, we'll educate you on it and we'll continue to communicate with you. But we need to have a room filled with people, and the one way we can do that is by communicating with each other. So let's work on our communication, bring it up to date with technology, and let's look at what our call to action will be after that. You have all these wonderful committees already working on certain things. So what I would say is, let's start communicating with each other. If we need to do more breakout sessions throughout the year to prepare for the conference, then let's do that. And then let's have breakout sessions where we're actually teaching people how to mobilize. I know that you work on voter registration, so let's make that one of our priorities. I'm trying to do that with the Latin community. Merging and unifying with other communities is another priority, because here we are working on these same issues apart instead of coming together and being more powerful. So we don't have a local La Raza group, but let's see if we can get one going, and if not, then we get the people from Philadelphia that want to help us and bring them in to help unite the Latinos in Delaware. We do have the Puerto Rican Diaspora group, which I am the chair, but I don't have any members. So I need maybe some of you to join and help us with this whole issue with Puerto Rico. By the way, there is a march tomorrow. I just found out about it, that they're marching in Puerto Rico, marching for equality for Puerto Rico. Because, you know, unbeknownst to many, they didn't think that Puerto Rico was part of America, but yes, we are Americans, we're US citizens, we're still the colonial country, you know, the colonial island that is owned by the United States. We don't have the same freedoms and rights, we don't have a member in Congress that votes. You know, we are being treated like second-class citizens, maybe even third, which we can blatantly see on the news with what happened with the aftermath of the hurricane. I mean, this is not how we treat our fellow brothers and sisters, our American citizens. I mean, you would think there would be one step above, but no, we're being treated like a third world item. So I think that's something that we should do. This is the other thing that the Women's March did. The first call to action was that one person send 5 postcards out, invite other women to come together, host the meeting. And if 5 women sent out 5 postcards, that's 25. And if half of them showed up, that's 12 people gathered in a room. The other thing we did was the letter writing. Contact everyone in Congress. Everything was broken down to 1, 2, there was 5 call to actions. Every 3 to 4 months, this is the next step. We were alerted through the app. This is what you should be working on. You know, 750,000 women. And if we're all doing this, can you imagine? This is why the phones were ringing in DC when the Affordable Care was going to be canceled, where other things were going on. Women, you know, asking for equitable pay, and all the other issues that were important to us, the environment. So see, the power of one, when you unite, you can get a lot done. The other thing was run for office. Women, you're going to get together, even if you don't have the experience, you're going to run for office, you're going to meet, we're going to support you, we're going to come together. And these are women in rural areas, places that we don't even know where they are, but they came together. So imagine us here in a suburb, in an area where we have the Northeast Corridor. You know, we're not the suburbs, we can get people here. This is the city, we can get together a lot quicker, a lot faster. We have transportation, we can make this happen. So the challenge was, you're gonna find candidates, you're gonna nominate yourself if need be, and you're gonna run for office. And we just saw how that took off last Tuesday, did we not? It was the women, it was the people of color. We came together. And where hate was spoken, if you were speaking against the transsexual community, in that community a transsexual got elected. If you were speaking against women, a woman got elected. If you were speaking against the Muslims, a Muslim got elected. All across the nation, so many women got elected to seats in their respective areas. So we did it. So imagine what we can do if we keep that momentum going. Imagine what we can do right here in Delaware, where we're underrepresented. I feel a slap in my face when I look at 3 governments, state, county, and city, and I don't see one Hispanic in a cabinet position, not one. Where's the outrage? Where's the letters to the editor? Where's the meeting? Where's the march? Where's the call to action? I'm not seeing it among my community, but I'm not seeing it either from the African American community saying, hey, how come there's not any Hispanic representation? See, that's the issue. Those are issues we could be coming together to make some noise. Because the people that are in leadership roles, even if they're not elected, but they're appointed by the elected officials, should look like us, should look